Ugh, I need to go to the bathroom.
Gosh, honey, it seems like you're going to the bathroom a lot.
It's like that all day and all night long. I can't help it. I've seen the doctor 3 times and he says it's not an infection, but it sure feels like one. I'm at my wit's end.
Maybe you should ask your primary care doctor to send you to see a specialist.
Okay, it sounds like you're having a lot of pain as your bladder fills up, so you're urinating every 30 to 60 minutes. Because it's so uncomfortable, you're up 4 times a night, and you feel like you're not emptying your bladder all the way. You've been given several rounds of antibiotics, but no one has actually found bacteria in your urine, which is frustrating. Is all that correct?
Yes, and sex is also really uncomfortable. What do you think is going on?
From your exam today, we confirmed it's your bladder that is tender, and we also know you're emptying your bladder completely, and there are no signs of infection. We also found out your pelvic floor muscles are very tight and tender.
So what does that mean, and what can we do?
Your symptoms and exam are all pointing toward a diagnosis of interstitial cystitis, or IC, which is also called bladder pain syndrome, or BPS, where there is an inflammatory cycle that triggers acute and chronic pain mediators and pathways that then create more inflammation. We don't have enough research yet to really understand why this happens.
No wonder the antibiotics haven't really worked.
Yes, in your case, there is a second problem as well. The bladder pain has led to the pelvic floor muscles getting very tight and going into spasm, which is why they were tender on exam. This is a separate condition that is very commonly seen with IC. For treatment, we need to try to break the pain cycle at a number of different places.
I'm so relieved to finally have some information about what's going on. I'm willing to try anything. Just tell me what to do.
The good news is there are a number of treatment options, so most women do eventually find relief. The bad news is it often takes trying and stopping a number of treatments before we get the ones that get your symptoms under control.
Well, where do we start?
The first things we do are behavior modifications to reduce bladder sensitivity and diet modifications to make the urine less irritating to the bladder lining, which is inflamed and maybe cracked. Here's a list of things to avoid because they make the urine acidic. One study found that 90% of patients with IC were sensitive to at least some foods on this list.
Wait a minute, this list includes cranberry juice. I've been drinking tons of cranberry juice to prevent infections.
Cranberry can help reduce infections, but it is acidic and is likely just irritating your bladder at this point. You may feel some relief just by stopping the cranberry. There are other things we can do if these steps aren't enough, but not every treatment works for every patient, so we need to work together to find solutions that work for you. Complementary and alternative medicine, oral supplements and medications, bladder installations, and procedures are all options we can consider in the future if needed.
At least I now know there are options that might work.
There is something else we should start with as well. The pelvic floor muscle tension causes pain with sex, which then in turn increases bladder pain and urinary frequency even more. To break this cycle, a pelvic floor physical therapist can help you relax these muscles. This really works for most women with this condition.
Wow, it sounds like there is hope after all.
Absolutely. Here is a useful fact sheet on IC from the American Urogynecologic Society for more information.
Great.
We'll get started on the diet, some of the behavioral modifications, and send you to a physical therapist. We'll have you come back in 6 weeks and see how you're feeling, and if we need to make any adjustments, okay? Call us at any time if you think you have a UTI. We are always happy to have you drop off a specimen.
I feel so much more hopeful at this point. Thank you.